Yeah, I think that's a great point. As you deal with the society, Imam, is this problem kind of more prevalent in the South Asian population? How do we deal with the stigmatization? Because if I'm going through a problem, the first concern I have is if I go to an imam or if I go to any masjid to seek counseling or help, I might become the talk of the town. So my social image is kind of priority for me, and that prevents me from seeking help.
Mm-hmm. I've seen a big shift prior to COVID to post-COVID. Mm-hmm. Prior to COVID, it was like, okay, Imam, we want to talk to you, but we don't want to talk in the masjid because the fact that people see two people coming into my office, it would be chit-chat, oh, they must have some problem. Mm-hmm. Now what it is, people don't care. They're coming in. That social stigma aspect is no longer there. During COVID, we had a great evolution of how these problems. I've tried to mediate 35-year-old marriages, and I saw 6 month marriages break, both of them breaking. And what happened was it was a total chaos across the spectrum. So right now we're in a position where the immigrant generation set a standard that the children felt compelled to follow, but they're falling while they're following that. And so as a society, this is my outlook. The immigration generation set a trend. They did great, but they also set a trend where their children will suffer, their grandchildren will be lost, but their great-grandchildren will set a new tone. There's going to have to be a 4-generation process in this, not just for how our communities function, how our mental health thought processes, how we protect our youth. Like everything will have to go, in my opinion, after I've assessed how Chicago is and how Michigan is. They're 4 generations. We're like 2nd generation going into 3rd generation. We're in
So is it more kind of a wave-like pattern, right? Once we hit the seabed, the only way is to go up and get better in the next few generations.
Let me add to that. I think also COVID brought in the Zoom world. So I think that for some people out there listening, if you're worried about somebody seeing you or being aware. So what has helped in my practice in clinic is Zoom or the video chat has definitely opened up that channel. So then, I recommend people, like, if you're really worried about that, a lot of the providers are doing, these telepsych video options, so you can use that. So nobody would know.
And that's HIPAA compliant.
Yes, and that's HIPAA compliant. You'll be in your home, sitting in your couch like this, in your own room if you want to. Like, even if you don't want, like, if you're an adult, you don't want your wife or your husband or somebody, like, even if you're an adult child, you don't want your parents to know, you could be in there. Nobody would know. You could really be so much discreet as much as possible. So you could have those sessions discreetly. Completely, so I think that's an advantage of having this new digital world has given that edge for psychiatry specifically. Because I agree with you, because a lot of times my biggest concern is when the patient comes to the clinic, they're all sitting there waiting in office, right? Then they all know who's what, where, and then sometimes it's hard for a lot of and I've told patients, like, in the past, like, if you're really worried, sit in your car, we'll call you for your appointment. When your appointment comes, you can just come to the office. Right. So I've done those kind of things. So what I'm trying to say is there are ways you can get that help. Now that with the technology, it's even opened up so many channels. If you're worried about discretion, you really can. So I think that's going to help change that, help with that mindset overall.
What I've noticed on my side is, despite having those opportunities, that immigrant generation is still hesitant. Yeah. Their children, they don't mind entering an office. Right. They won't mind getting on Zoom. They won't mind getting on Google Meet. Yeah. But it's interesting how these dynamic plays out. I think factoring generation, I think that's a factor, but also the severity of the situation. Yeah. If the severity of the situation compels you, we had a case once, the wife literally beat the husband up, bringing him into the masjid, and they were fighting outside, and we had to call for security because it was going out of hand. So when you're tipping, you have no control of yourself anymore. You don't care about what's happening around you also. So I think it's very important for people to realize you don't have to tip to realize there's a problem. Everything that led up to it was explaining to we're going the wrong direction. So yeah, discretion is
I'm sure there are red flags
100%.
leading up to any major outcomes, right?
Sure.